Good morning, everyone. Thank you for being with us to celebrate this exciting event. A few quick reminders before we get started. Since we are outside, and if you are fully vaccinated, you can remain unmasked. And when we go inside to begin our tours, we would ask that everyone be masked during the entire time you're there. Thank you for that. To get started, I would like to introduce Tammy Bending, our Vice President of Critical Access Hospitals, Berlin and Wild Rose. Tammy.
Thank you, Cassandra. Well, good morning. What a beautiful day. It's good to see all of you too. Thanks for everyone for coming. So, welcome to our community members, our board members, construction and architect partners, generous donors, ThedaCare Family Foundation's representatives, ThedaCare team members, leaders, and members of the media. So thank you for joining us this morning on this important milestone here at ThedaCare Medical Center-Berlin. This is for our community of Berlin and our team members. So to ensure access for an increasing demand for emergency care, we're proud to announce the completion of the new emergency center at ThedaCare Medical Center-Berlin. As you can see, those of you who were here maybe a year ago, the landscape has definitely changed. And as one of our foundation board members said, it looks just like the picture. Right, Meg? Awesome, we did a great job. So we did break ground in fall of 2020. And we do have, if you look around, we have the new helipad over there. So ThedaStar and our other air ambulances have the space they need to save lives of our critically ill patients. You see new parking lots, new ambulance garage, which Evan and team are very happy about, and they'll show you that in a while. And the emergency department itself. So while it is incredible to see the final pieces of this project now complete, we know it's more than that. So today is the day to celebrate the patients and families who will now receive emergency care in a modern facility, getting them back to living their unique, best life sooner, and to celebrate the Berlin community and the generous donors whose support made this project possible, and to celebrate the compassionate caregivers who will come to work here day in and day out, who will make this building what it needs to be for the communities we serve. So a little bit about how we do serve the people of Berlin. We have 70,000 ambulatory visits a year, 8,000 ED visits, 4,000 surgical procedures, 3,000 oncology visits, 2,000 admissions, and the new ED will enhance the care of the people of Berlin that they have known to come to expect from us. And those numbers, they're more than just numbers. They're the people, friends, neighbors, and family of this community that we're so happy to serve. They deserve the best care possible, close to home. That's why ThedaCare has invested in this project, and ThedaCare continues to prepare in response to the needs of our community, keeping our patients, families safe and healthy now and into the future. Enhancements to better the patient experience were funded through generous donors who support the ThedaCare Foundation Berlin, which is part of the ThedaCare family of foundations. The foundation committed to contributing at least $500,000 to this project, and the donations ended up coming in at more than $900,000. Thank you so much to the community for that. We are forever grateful for the support from our generous donors and the community. We're especially thankful for the ThedaCare Foundation's Berlin Board of Directors, as well as the members of the Capital Campaign Cabinet for their tireless efforts to engage with the community in this amazing fundraising effort. You'll hear more from one of our donors in a bit. Countless hours have been spent on planning, design, and actual construction, with the majority of the work taking place during a global pandemic. So I do want to take a moment to discuss that. We've all been through a lot. We're still there, but we're coming out, seeing the light with COVID. But I will tell you, it has affected this project more than probably most people think. We did start the project, we started planning. When COVID hit, we ended up taking a couple months off from construction because we really didn't know what was going to happen. We then had to do a lot of Zoom meetings, which when you're trying to do construction, we made it work, right guys? But it was difficult, but we did it. And I will tell you, I'm so proud of our teams because the project, COVID, the project took longer than it originally had planned for. And the team members from the ED team, all of our team members in the four walls of the hospital, really, really did great. It was hard some days with the noise and the building actually shaking because of everything going on, and we thought, my gosh, are we going to last? But we did. But I really want to say thank you so much to the ED, the team, because they started, their space started becoming smaller and smaller and smaller, and they have been so flexible. So thank you, Kelly, and your team. I also want to thank our Bolt partners who did a great job keeping us on track, our HGA architect partners, and most importantly, Nick Roden, who was our project manager, who probably, I'm pretty sure, had more sleepless nights than I did. So thank you, Nick. You did an amazing job. So again, I want to say thank you to everyone who made this ED a reality. Each person and team played a significant role bringing this space to life. Thank you from all of us at ThedaCare and the Berlin community. So next, I'd like to introduce Lynne Detterman, who's our Senior Vice President of the South Region.
Thank you, Tammy, and thank you for your leadership during this project. I am so proud of the entire team here, and I can't wait for the community to see their new emergency department. So I get to tell you about how important this emergency department is and how important this hospital is to the community and the surrounding communities. But I know you already know this, right? So ThedaCare Medical Center-Berlin is an accredited critical access hospital by the Joint Commission, which earned a gold seal of approval, which is an internationally recognized symbol of quality. By following the Joint Commission standards, this facility continuously demonstrates a commitment to ensuring safe and effective care to those we serve. Healthcare needs can be different for people living in rural areas, and I've lived in rural areas most of my life, so I can attest to this as well. And as a ThedaCare facility, we strive to understand each person's unique medical background, lifestyle, personal goals, so they can live their best life. Therefore, the need for emergency services in rural areas is significant. A study in the Journal of American Medical Association demonstrated that prior to COVID, rural emergency departments experienced more than a 50% increase in patient visits during a 10-year period of time. This was despite the fact that the population was declining. The emergency department update is a highlight of ThedaCare's commitment to delivering high-quality care throughout our service area and ensuring convenient access to health care for people living in Berlin and the surrounding communities. We believe healthcare needs to be local and have made several investments in addition to the emergency department, such as our surgical robot, to demonstrate that commitment. So next, I'd like to ask Mark Thompson, ThedaCare's Chief Financial Officer and Chief Operating Officer, to tell us more about this community investment.
Thank you, Lynn. This is a great day. Long time planning and a long time getting here, so through interesting times. ThedaCare continues to prepare and respond to the needs of the community, keeping our patients and families safe and healthy now and always. Our commitment to providing, and it hasn't been said yet, this is a level 4 trauma center that we electively chose to take on that designation and have passed it, obviously. And this will just continue that legacy of making emergency care here in this region, Berlin and surrounding community, for those patients that we serve. We continuously thrive on working and understanding the changing needs of the community and assuring that we provide that access to health care that this community needs. That's what this is, another step in that journey. We must be ready to offer the right care in the right place, in the right type of facilities, for the people who need us now and 20 years from now. And that's what this project is about. This facility will serve not only the current generation, but generations to come. We're building an ED for the future for this community. We couldn't have done this without, and Tammy mentioned some of the key players, but I want to pause a moment and recognize them. We can't do this without our partners. You can't build a facility like this, so we intentionally engage some partners that are specialized in healthcare, and that being, and along with the clinical team, which sat side by side via Zoom, if you will, to make sure that we constructed the right facility with the right flow for our patients and also our caregivers. So I'm going to take the opportunity, Bolt, who was the lead construction manager, and I know underneath Bolt is a whole lot of trades that were also involved. HGA, who was our planner and designer, and it takes all these three parties, ThedaCare team, as well as Bolt, as well as those trades, as well as the architects and planners to all come together to make this happen. So if the representatives, and Nick, you're part of that team wherever you are. I heard your name, but I haven't seen you. There you are, way back there. Okay. If you can stand and be recognized so that this group understands all the hard work that this team did. So thank you guys. As mentioned, these guys are specialized in it, and I think you'll see that here in a second on the work that they did for us. With that, I'd like to invite Dr. Batley. Gotten to know Dr. Batley well over the years. He's a family medicine here for the community. But in addition to that, he's the ThedaCare Medical Center-Berlin's medical director, and he sits on the board here at as a trustee member. So he will tell us a little bit more about the insights from a clinical care of what this means for our patients in the community as well as our caregivers. So Dr. Batley, please.
Thank you, Mark. What an exciting day, right? Exciting day for our team members, for our community. It's been a long road, as Mark had said. It's here. Very excited. As Mark said, I get to tell you a little bit about what's inside the four walls and all the planning that was done and the exciting things that you'll eventually see in a few moments. Our goal for this project was to create a modern facility that will provide the best experience for our patients and their families and offer the most efficient work area for our healthcare teams. The 9,000 square foot emergency department was designed for the well-being and ease of patients and their families in a comfortable, soothing environment. It was a true partnership with our physicians, clinicians, and staff to enhance the patient and provider care experience. The layout for the space is centered on the patient. The healthcare team's workstation is located in the center of the area with treatment rooms on the perimeter. This allows teams a direct line of sight into each room, which improves patient safety and quality of care. The number of treatment rooms have increased from 7 to 10, and the size of the rooms have expanded. This will allow patients to have family members with them while still providing plenty of space for healthcare workers to provide their essential work. The size of the trauma room has increased as well. We also added room with a bariatric lift to aid care providers in transferring disabled patients or those who have difficulty standing. Through the commitment to understanding the unique needs of our community, we recognize the increasing demand for behavioral health support in emergency departments, specifically in the rural settings. To address this, the new space includes designated rooms for behavioral health services, keeping the safety of patients and team members top of mind. We know rural hospitals are unique. and must address the specific issues of our small cities and towns, our team members ensure that we deliver the best possible care to each patient, and now we have even more tools and resources to provide that excellent care. We will have a dedicated decontamination room with a shower. This is where understanding the community is vital. We are a part of a large farming and agricultural business community, so the chances of a chemical contamination are real. This specialized room will allow us to be able to care for multiple victims should that situation arise. To adapt to changes stemming from COVID-19 pandemic, the design plan was updated in real time. Negative pressure rooms, also called isolation rooms, were added as a safe place to care for those with infectious diseases. During an emergency, time is of the essence. Minutes, even seconds, count during an emergency. Our emergency medical teams at TC Berlin, who care for our community, have expressed their gratitude and excitement for this new space. They are most excited about the additional physical space to do their essential work in an emergency, but also the technological advancements and the attention to organizational detail as the most appealing aspects to this plan. We wanted to thank our team members and patients as they worked through our construction, and we were allowed to continue to provide emergency services to our community. Now to talk a little bit about the community support, I'd like to introduce Tammy Shire, lead donor for the Emergency Department project. She has graciously committed a pledge of $250,000 for the project and asked the community to come together to support the project and match her pledge to make our community healthier and stronger. Tammy?
Thank you, Dr. Batley. I am a former Berlin Memorial Hospital Community Health Network employee as a health information technician for 19 years. I was hired by a local resident, Beth Malcheski, and worked alongside Regina Randall, who started at the hospital in Berlin in 1937, when it was located at the intersection of Highway 91 and 49, sharpening needles on a whetstone and repairing rubber gloves. Regina was the longest employee in the hospital's history, that being 66 years, and retired at the age of 90. She set a great example. Healthcare has a long legacy in Berlin, with the Yates Memorial Hospital opening in 1912. And Berlin Memorial Hospital became affiliated with ThedaCare in 2014. For Berlin, the fact that care is offered here is critical. We can get cancer care treatment, see a cardiologist, and access specialists without driving to the valley. And when we need it most, emergency care is right here. Enhancements to better the patient experience were funded through generous donors who support the ThedaCare Foundation Berlin, which is a part of the ThedaCare family of foundations. As Tammy Bending mentioned, the foundation committed to contributing at least $500,000 to the emergency department project. In total, the donations were more than $900,000, which included a number of fundraising efforts in the community. As I posed a challenge for the community members to come alongside me and support this project, I would like to express my sincere gratitude to this community and to all of its donors. I commend the donors for accepting my challenge. I will reference this too, and for something you to think about, the little oyster that had a granule of sand intruding on its inside would never have made a beautiful pearl had it not been given that challenge. Without you, this state-of-the-art facility and all its enhancements was only a dream. Your contributions have made it a dream come true. Thank you to all the people, the foundation team members, those who helped with fundraising projects, team members and staff at the hospital and in our surrounding communities, and all of our donors. Congratulations. We are lucky to live in a community with the best in healthcare and staff and all of our resources. I am proud to have been a part of its growth and excellence, and also to call this area home. Now I'd like to introduce Dr. Andrabi, the ThedaCare President and CEO.
Good morning. You've already heard all the great things, so I have nothing great to say. But Tammy, thank you so much, and thanks to all the community members and the donors and all of you, because you all played a part in this. I just want to reminisce for a second and remember, I think it was August of 2018, I brought the entire ThedaCare board for a meeting here in Berlin. Some of you remember that, Tammy does. And I took them into the basement and I said, let's have a meeting here. And then as a part of the meeting, I said, we're going to go on a walking tour. And little did they know I had already orchestrated all of this. Now I can tell them that, right? And we walked through the emergency room. And then we didn't have to say anything. And everybody understood. And, it's just such a proud moment to stand here in front of all of you and just watch Tammy and her team and Dr. Badley and Kelly, who's been waiting for 20 years for this ER to come to fruition, right? This is the day. I remember when we did the kickoff and then when we did the groundbreaking, and here we are. So from the bottom of my heart, thank you to this entire team for your resilience, your commitment to the community and living our mission of improving the health and well-being of our communities while empowering each person to live their unique best lives. When I think about unique best lives, I also think about how do our team members get enabled to live their unique best lives, bring their talents forward to be able to take care of this community as well. And I hope that this space enables each one of them to do that. So thank you to all of you. Tammy, thank you for your leadership and all the other folks who are here to be a part of this endeavor. And I'll keep nudging Mark Thompson, and hopefully this is not the end of our projects. And we continue to build this community for this community so we can keep the appropriate care local and make it easier for people to receive care. So thank you to all of you. I will bring Tammy Bending back, who's been a great leader. A round of applause for you. And then you can help us end this conversation.
Thank you so much, Dr. Andrabi, and all of our speakers. I can't tell you I can't tell you in words even how grateful I am for all of you. For this community, our entire area that we serve here in Berlin, for this day, for everything you see in front of you. It's because of you. It's because of my team. I have an amazing team. And today is so special, more than many of you probably recognize. So thank you. So now we're going to cut the ribbon and we're going to make it official. And then after that, we're going to do small group tours. So we'll have people meet here in the front, and we want to do groups of about 10 people to go through so you can hear and people can see. And we'll do that until we're done with everyone going through. So again, I want to say thank you, all of you, for joining us, making this project a reality. And don't forget to have a cookie. That's the best part, right? Cookies? To have a cookie before you leave too. So thanks everyone very much. All right, so if the speakers want to come around, please, and Tammy.
Everybody just looking here, give me a good smile. All right, go ahead and cut that thing.
I asked her if it would do it, really would do it.
Yeah.